Good evening, ladies and gentlemen. A very warm welcome to this groundbreaking webinar on the application of AI in ECG. My name is Dr. Roshni Chan Ganguly, and it is entirely my pleasure to introduce today's session. The ECG, as we all know, is an essential tool in diagnosing and managing cardiovascular conditions. However, interpreting ECG can often be intricate and time-consuming, with the potential of human error. This is where artificial intelligence becomes a pivotal ally, and AI, with its remarkable ability to analyze extensive data sets rapidly and accurately, promises to revolutionize ECG interpretation. We are privileged today to have with us an esteemed speaker, Dr. Mukesh Bhargava, a distinguished internal medicine specialist and the visionary co-founder of IM Care. Dr. Bhargava has dedicated his career to advancing patient care and innovating within the field of internal medicine, particularly in cardiovascular health. With an impressive background that spans both clinical practice and entrepreneurial leadership, Dr. Bhargava brings a wealth of knowledge and experience to our discussion. His clinical expertise is complemented by his keen interest in integrating cutting-edge technology into healthcare, ensuring that his patients receive the most effective and up-to-date treatments available. In today's session, Dr. Mukesh Bhargava will guide us through how AI-driven ECG analysis is being applied in clinical practice, the benefits it offers to patients and healthcare providers, and the challenges we must address as we move forward. Our moderator for the session today is Dr. Kamlesh Bhargava, who will be facilitating the question-answer sessions following the presentation, and the vote of thanks will be delivered by Dr. Srividya Raghavendran. Thank you, everyone, for joining us, and we look forward to an engaging and enlightening discussion as we explore the intersection of technology and medicine. Thank you. Welcome, Dr. Mukesh Bhargava.
Thank you. Thank you, Roshni. Thank you for that kind introduction. I'm deeply honored to be here today and grateful for the opportunity to speak to such a group. It's a privilege to share my insights on the practical applications of generative AI in electrocardiography. I would like to extend my sincere thanks to the organizers for inviting me on this Sunday meeting, and for all of you to having taken the time out on Sunday to do this and advancing the learning in medicine. I look forward to our discussion and hope to provide you with valuable insights that you can apply in your practice today. And the way I have planned this is I will provide you with my perspective of the current state, using ECG interpretation as an example, and we'll follow it up with a live and interactive demonstration on how it can be used today. And then we'll open it for questions. And I really like that Roshni said that this has the potential, but stay tuned of the pitfalls. This will be a balanced discussion, not a just AI can solve all of our problems. So I'll share my screen, and I'll use ECG as an example, but this is just a conversation starter thing. So the context, and this is a saying from Alice Moore's Earth. Yesterday is history, tomorrow is a mystery, today is a gift, and that is why it's called the present. So just keep this in context. We're talking about today. I will refrain from these predictions that folks around could be making that AI will do something. My focus will be on today, which is a gift for all of us, and especially after India having won the World Cup yesterday. So it is a gift. So what is a desired clinician? If all of you here have some interest in clinical medicine, and what we look for in a desired clinician is a person who is competent, who has an ethical practice. They are patient-centered. They continuously learn, which is evidenced by you being here today, such a august group of people who collaborate. The Setu project, the other things that you do, that is really collaboration that you didn't have to do, but you do. And then do it professionally with professionalism, and you always focus on quality improvement. That is a desired clinician. With that said, this headline came around in March of last year. They said the new GPT-4 AI gets top marks in law, medical exam, OpenAI claims, which means all of us in this room who are knowledge workers, who have taken some exam for certification, there's now intelligence around in a machine that will beat us at those exams. And the statistic was somewhere around 90%. So if this is true, does this mean that this will change and we will become irrelevant, meaningless, or doctors will be, or clinicians will be replaced by machines? So this got my interest when you say exams can be replaced, and then it is like, oh, maybe it can make better decisions. So with that, what is generative AI changing today? It is changing how medical imaging and diagnosis is done. Clinical decision-making support is being provided with that. Natural language processing, which is ambient AI, people just putting their phone in the middle of the doctor and the patient, records the note, creates your progress note, and even gives you advice what you should do. Drug discovery and development, virtual health assistants, bots or AI-powered bots are answering questions that folks would otherwise answer. Predictive analytics and population health management, fairly big field, and medical education and training, how to train the new doctor, the new nurses. Can we have simulators which are AI based with AI technology? So just to set, I saw Kamlesh had shared as what the audience is, and I said there I would share with you what is the difference between a computer program, artificial intelligence, and then subsequently generative AI. So really, if you think about it, a computer program was written by programmers. It was preset. The rules were set. If this happens, do that. Or if this is, if you type A, it should look this way. And it was a pre-programmed set of instructions that were executed by a computer. Artificial intelligence came about as a simulation of human intelligence by machines to perform tasks. And then what is the latest or the newest, which we most commonly known as ChatGPT or GPT, is generative AI, which is that it is a subset of AI that is focused at creating new content, data, and outputs, and based on existing or information. So it will create new information. It will learn this, and often in creative and novel ways. And it will do it faster than what we as humans can do. It learns patterns from data to generate new content. So this is where it is changing. So if we come to ECG interpretation, most of the ECG machines have an auto interpretation. That is a computer program. Most of them use some modification of what is called the MINS code or the Minnesota code, which has, these are the types of rhythms can be, and it classifies, it does a numeric tracing, and it is not bad. It is on a clean ECG, it can be fairly accurate. So what we are talking about is, where does this go after, once we know that the machine can provide a computer program to generate a report, but can artificial intelligence or generative AI do better? Can it ace that? So there are two use cases I would propose, and one of them is a clear winner, which is if you wanted to learn how to perform an ECG, if you wanted to have a framework of how to learn, you could go to a book, you could go to a teacher, but this is where artificial intelligence or the generative AI tools, whether you use ChatGPT or use Perplexity, whichever you use can help you learn. And because you can have a conversation back and forth, you can say, what is the criteria for diagnosis? Something, and I'll show you some examples. And then the second part is really analyzing the ECG instead of the human, or it is in addition to the human, or it is that the ECG is analyzed by machine learning and artificial intelligence, and the human says whether it is right or wrong. So what we'll do is literally think of what are the learning requests, and I'll do a live demonstration of this. But you could put in, please create a checklist for performing an ECG. And this is a simple ask, and it will give you a checklist for whoever wants to do an ECG, whether it is a doctor, whether it is a nurse, whether it is a technologist, and it will have step-by-step instructions, place the electrodes, etc. If you say to it, where should I place the electrodes? It will answer that question, and it will do it pretty accurately. If you do it in Perplexity, which is the brother of ChatGPT, it may even show you pictures sourced from the internet, but you still have to figure it out. So it will be a very easy thing to create a manual to how to do ECGs. You can say, please create a checklist for interpreting ECG, and you will find that it will either source it or create its own, or it will try to make that happen. You can say, please tell me how to analyze a P wave on an ECG, or create a table of differences between the right and left bundle branch block. So these are what we call prompts. What are you asking for it to do? So here's an example. The prompt was, tell me the type of P waves and tell me what they mean. And create it in a table, a 3-column table. And in the first column, put in what is the name of the wave, what is the characteristic, and the third, what the implication is. And 15 seconds later, you have the table out there. So you don't have to go open a book, find the index where they're talking about atrium and P waves and those kind of things. Within 15 seconds or less, you have a nice looking table, and it is for most part accurate. This is where it outperformed us in the medical tests, where is to find the information that is already there. Here is the difference between there are two versions of ChatGPT. One is you can go to chatgpt.com, and without paying anything, you can get what is called ChatGPT 3.5. ChatGPT 4.0 is the paid version. And if you asked about left bundle branch block, this is the only difference. The top column represents what you would get for free. The second column is 2 or 3 extra lines, maybe a little bit more, but it gives you a fairly good sense of what you need to do or what you need to learn in the free version. So then comes, the analysis requests. So we talked about in the first few minutes of you can learn how to read an ECG, which I think is very important. We'll come to the conclusion. But analysis, how can you analyze an ECG? You can use your phone, take a picture, and just say, analyze this for me. You can upload a PDF on your computer or desktop. You can, snip and paste, which will work quite well. The things to remember is when you ask for it, if your ECG is in color, the classic pink sheet with black, nice graph, it will be better than the black and white version. If you include the header, the auto interpretation that the machine spits out, it will actually confuse your large language model more, because it will try to put its own interpretation and what the machine said and try to say, okay, how can I have some kind of consensus between those two? This is what I found. And then noise versus artifact. So how did I do this? This was my personal experiment, and this is what I think got the interest of the organizers of the group. I took, I was on call. I had all the hospital's ECGs to read. I had 124 ECGs to be reported. I sat down, I said, I'll report them manually the way I do. And then I will snip and just put the ECG in a chat in the chat GPT and compared the two to figure out whether there was consistency, accuracy, patterns of errors, and if there were certain words or things that I would put that would make the answer to be correct. Now, of course, you are all science people with background, with tremendous education who will say, oh my God, this is a lousy study. There are many limitations. One person, no second umpire, sample size is small, and there are, of course, unconscious biases, whether I believe or no, don't believe, and I'm trying to double check myself. But those are the limitations. So generative AI was consistently it was the winner in consistency. It reported every single item, right or wrong is a different story. We'll come to that, but it said, oh, rate, rhythm, whether there's a bundle branch block, whether there's a heart attack, ischemia, whatever it is, it was consistent. It filled in all the check boxes. I would propose the human accuracy was superior. There was no patterns of errors that I found, and we'll show you the examples. The color and the quality of the ECG mattered. So if the ECG was in color, it mattered. And the funny part was when the chat GPT made an error, and I said, gee, what do you think? Why is this ECG not showing left bundle branch block? It said, oh, I'm so sorry. I made an error on review. I've looked at it. It shows left bundle branch block. I asked it, so why did you make the error? And then it said to me, oh, it is very, very complex to read ECGs, gave me a very generic, politically correct answer. And then I fed the same ECG again, and it tended not to make that mistake again. So it gave a signal that, gee, it was learning from its mistakes. So here is, based on the things that I saw, these would be my recommendation before we get to the live demo part of this talk. If you want to interpret ECGs, you must learn ECG reading. There is no shortcut. This is not the technology that you can just picture it with your phone and it'll tell you. This is not the Shazam of music that it'll tell you who the musician was, etc., etc. AI can augment your learning process. It can make it simpler, easier to your learning style. AI cannot replace you. This is, I think, a fairly confident conclusion I can make for today. Again, tomorrow is a mystery, but today, the present, it cannot replace you. However, doctors and clinicians who use AI will replace doctors and clinicians who do not use AI. This is my firm belief because this is more about efficiency and tools, just like, engineers, if they said, I don't use a calculator or some of the tools they have, it is hard to practice. So are we ready to try something live? Okay, so let me see. So this is the chat GPT screen, and I understand that some of you have not seen this before. So I'll walk you through. On the top left that's the sidebar. This is the new chat. To start a new chat, it tells you which version of ChatGPT you're using. You can use ChatGPT 40 or 3.5. 3.5 is free, and 4 and 4.0 are the paid versions of ChatGPT. So all you got to do is message ChatGPT, and I would say think of this as a person that you're interacting with. So I'll say, because it is morning here in Canada, good morning, and it'll give you a very courteous message back. Good morning, how can I assist you? And we say, I am sharing your capabilities for ECG reading. Are you ready? Okay. So it says, yes, I'm ready. And again, I didn't have to do this, but I said, let's be polite and nice. So all I'll do from another screen, which you are not able to see yet, or I will not have you see that screen. I will just copy and paste an ECG. And so I've snipped it and I paste it. As you can see, it's a little pink icon. The ECG is uploaded. I hit the arrow and you can see the ECG that is up there. It says, thank you for sharing the ECG. It tells you here are some things to consider, and it is trying to give me a general thing. And from a quick glance, it says the ECG, the rhythm appears to be regular, the P waves are present, and those kind of things. And it says for more detailed analysis, ask more or whatever it is. So please, I will say, please provide a report. I am a physician. So it goes ahead, it'll think, and it says it didn't find any patient name, etc., because there was none. And then it said the heart rate, it will try to calculate again, and it is giving you a lengthy report. You can shorten it as much as you want, but it is literally saying that interpretation, this is a normal sinus rhythm ECG, no abnormalities are detected, which for this ECG is the correct answer. No immediate intervention is necessary based on this ECG, clinical correlation, etc., etc., and it is willing to sign off on your report if you let that do. Let's try to give it something that is not normal and see if it, which we all will agree, is not normal. Those of us who are used to seeing ECGs. So, and let's see how accurate it is. So this is another ECG. Let me know if you can you see the ECG?
Yes, we can see the ECG.
Okay, so this is the ECG. As those of you who read ECGs, this patient has a pacemaker and clearly has a pacemaker. And here's what it says. The summary interpretation is irregular rhythm, likely consistent with atrial fibrillation, no ischemic changes needed. So it was 100% wrong on this ECG. This is a paced rhythm, but because it was slightly irregular, it went on to say that this is an abnormal ECG, and it was also incorrect about the abnormality that this ECG had. It was a clean ECG, it wasn't color, and you could realize that. Now, let's try to ask it, don't you think this one has a pacemaker? Don't you think that the patient has a pacemaker based on this ECG? And it'll think, guess what? It says, you are correct. Upon closer inspection, this ECG indeed shows characteristics consistent with a pacemaker, and it will tell you what was those correct characteristics, etc., that why it said it had a pacemaker in there, because it says regular rhythm pacemaker spikes indicating ventricular depolarization. Now, if you say, why did you make that mistake? So you can play around and for a long time trying to learn and those kind of things. And it says, I apologize. The oversight is my initial interpretation. Recognizing pacemaker spikes can be sometimes be subtle, and I appreciate your correction. Here's the revised report again for clarity. So again, you need to know your basics, and this can augment it, but it will not necessarily replace, and certainly it is not the only tool you should use. It can make you look like a fool because the ECG analysis, the person who you send the report to, they'll say, you know what, you don't know what a paced rhythm looks like, or what does atrial fibrillation look like if you call a paced rhythm atrial fibrillation. So that is in terms of doing this. Now you can do the same thing on a different model. This is a model called Perplexity, which is slightly different than ChatGPT. It is made by another company. And what I also did was said, let's give the same ECG to another thing and another chat model and see what is the quality of interpretation. So let's tell it the same thing. Can you help me read an ECG? So it'll say, yep, certainly reading an ECG is an important skill. It gives you a long-winded answer of what the norms are, what it'll look for, etc., etc. And it's ready for us to upload an image. The summary of this, if it worked, which I apologize, it didn't work for Perplexity, is that it will also give you the same thing, but in a slightly more collegial way. So, it will be less sounding more like human-like rather than totally like a machine or clinical algorithm. So that part is sharing on the ECG. I'll go back to the non-live demonstration. Let's go back to it. Okay. So in my personal experiment, again, I would say that it is not ready for clinical use, that you can just do put in an ECG and think that it'll give you a right answer. It will make you hit a panic button at times. It'll say show the heart attack when it doesn't. So it's not ready for use, but it is really ready for you to learn how to do ECGs. And again, this was with my limitation. Now, again, coming back to it, that yesterday was history, tomorrow is a mystery, and we are in the present. I would say keeping the learning going, doing good work while we smile is the way to go. And I will open it up for questions because we did want to leave a good amount of time for questions.
I have a bit of curiosity. Dr. Mukesh, if you can share the ECGs which you had put on ChatGPT, because we could see that you're sharing, but the image was not clear. We couldn't
Oh, okay.
see. So then we could maybe read the ECGs and.
Sure. So this is the paced rhythm ECG.
Mm-hmm.
So these are the ECGs I just snipped, and clean, nice looking ECGs, and one after the other in my experiment, put it in and seeing whether it works or not.
Staff while doing ECG, what about such ECG interpretation? So human errors while recording an ECG, wrong leads, etc. I think that's what the question.
So we did try to see if it would catch a lead misplacement, or it will not on a consistent fashion. I would say it is not reliable enough to say that you can do a quality check whether the ECG was done correctly or not. It may pick it up, but it may miss it completely. So not really.
So, for example, if you put a positive AVR lead ECG just to check whether it's sensing that there's a wrong lead placement. I
Right.
mean, so will it tell us, or we haven't tried it as yet?
I did try it.
Yeah.
Tried it twice to say, okay, can you tell me if the lead placement is correct? So if you specifically ask, is the lead placement
Right.
correct? Then it will do it. Or if you say, why is the lead AVR, why is the AVR positive? Do you think it could be lead misplacement? It will give you a differential. Yes, it could be lead misplacement. It could be dextrocardia. It could be whatever it would. And that would be an accurate differential because it would not want to commit. Now, if you said you did present with the ECG some clinical history, then it does become more sophisticated in giving you the answers. So if you presented it a right bundle branch block and say, this is a 30-year-old person who had an ECG who's completely asymptomatic, could you interpret it for me? It may recognize the right bundle branch block, but it'll say it's usually benign and it'll give its own commentary. If you said this is a 35-year-old woman with shortness of breath and a swollen leg and what have you, it will give you a larger and a more clinically relevant differential diagnosis that this could be right bundle branch block, secondary to pulmonary embolism, and the swollen leg maybe TBT or what have you. So it will help you do that. So again, the prompts are really important. This is not just point and shoot. You have to really frame the context in and then go from there.
We have other questions too. So I think you have just answered Dr. Rakshit's question. Doesn't adding clinical information help generative AI give better interpretation?
Absolutely.
The answer briefly is yes. Secondly, how you frame the question is very important, the prompts as we call them.
Right. So I would be careful in saying it'll give you a better answer. It will give you a broader answer. It will give you a more sophisticated answer. It may not be the most accurate answer because it is one of those that it doesn't have a major self-reflection. The accuracy, the reason why I think it did well on exams, because most of us who have taken multiple choice exams, it is easier to pick amongst the four choices which is the right choice. But if you just have the patient presents with blank, they don't come in with four choices that you have to pick what is the right diagnosis. So it is better at exam taking, may not be as good, or is, I would not say may not be, it is not as good at clinical practice.
So Dr. Zakaria just mentioned, looks like a long way for ChatGPT to improve before it can be trusted for reading ECG. My response to that would be, this technology is improving by leaps and bounds. Earlier technology, by the time it developed, it took months or years. Nowadays, it's a question of weeks or months, not years. So it is in the process, and a lot of people are doing it.
So be careful. Right now, if you go into ChatGPT, there are specific ChatGPT libraries that claim that they can help you read an ECG. And I say that is actually incorrect. They are not accurate and they can be dangerous. So it is really important for the group to understand that this debate about AI needs to be regulated, etc. And those of us who may not like rules and regulations that much may say, no, they should be let free. It is out there. And if you're not an if you're not you don't have your basics correct, you will rely on something that is just fake. So, and it will look like a very good interpretation because it is very good in its consistency. It is better than the human. It will always say, I know what the P wave looks like, QRS, and those things.
Thank you. So another comment was that Dr. Vandana has mentioned, I think for people who are naive to ECG, it's a good means, and I would complete the sentence to learn things like Mukesh just showed, P wave. You can get the differential diagnosis of all the P waves. And if you can read it that, oh, first of all, you need to identify this is the P wave and you are not mistaking it for the T wave. And then it is bifid or up or down and what's the length, duration, etc. Then it will give you an answer. The advantage of all this chat GPT, etc. is, number one, it does not judge you. It gives an answer. Because traditionally in education, and especially in India, asking questions is a big no-no, and you are looked down upon. Maybe things have changed now, but that's how I was taught. Oh, you don't know this. But chat GPT is non-judgmental for all this. Would you like to add anything to that?
So absolutely true, and I'll give you another experiment that we had done. I needed to learn about a subject matter, and it was cardiac amyloidosis. I was going to a talk, and there were articles on my desk to read. And what I did was uploaded those articles and said, now answer my question. How do you diagnose this? What are the tests I can run in the province of Ontario, Canada? What are the tests available to me? Who are the experts in this? Who has written papers on this topic? And it gave me answers that were contextual for me as a practicing clinician. And you can literally say to it, generate a syllabus for ECG learning for a medical student.
Dr. Ghulam Mustafa says, so it's basically that we will have to do all the work. The answer is
no. So let's not take away the credit where it is due. We uploaded a piece of paper, a picture. It was able to accurately recognize that it was an ECG. You show this piece of paper to a 8 or 10-year-old, they'll say, I don't know what this is. This is a colorful graph. So it was able to consistently recognize that this was an ECG, that there are PQRST waves, and this is what it is. It is able to do a whole lot as a machine that it takes a lot of training. All of us here in the room are a biased cohort in the sense that we know this stuff and we are expecting it to do more. So it is the ability to complete those. So the key is to stay tuned. And that is why I call that these talks that whenever I do are conversation starters. They are not the end. And if you think that we'll still have to do all the work, yes, still have to do all the work, but it may become easier than what it is now.
So Dr. Vinod Kumar says, so till date, ChatGPT is learning tool and it cannot be used in clinical setting for diagnosis purposes. What I understand today from the talk, please correct me if I'm wrong.
So I would say that you are right, that the thing to use ChatGPT today is you cannot use it for interpretation. I would suggest you do not use it for interpretation, and that is a clear no. What you should be able to use it for is how to learn, how to test technology, how to learn about AI. The reason why I did this, I wasn't trying to replace myself by using a chatbot. I was trying to say, what can it do? There are things that it can do quite well. It can take textual notes of yours, 5 doctors' notes, put it together and say, can you summarize what Kamlesh said, what Roshni said, what Dr. Kishore said? I'll take all their notes and say, can you say where they agree and where they disagree, where these 3 doctors disagree? So it will it is what you can use for now. But for interpretation part, that is why we had broken the talk into doing the ECG, learning the ECG, and then the second stream was analysis. Analysis is not ready for use.
The way I understand it is, don't lose confidence, learn how to read the ECG, learn the PQRST and the various configurations, have confidence in yourself. And the example is yesterday's cricket match.
There was a very classic study where it said it was trying to say whether it can read X-rays for pneumonia during COVID, and it labeled the hospital that had L, which was literally meant it was left side, but that was a hospital that was a COVID hospital and had more pneumonia patients, so it thought L was associated with pneumonia. All it was that this is the left side, so it made a very dumb mistake. But it just said every time there's been an L, there's more chance of pneumonia. So that is the bias. So we as clinicians really need to know what is the accuracy of these before we use it. And again, I can tell you, do not use ECG using your phone and saying, I'll take a picture and then make a decision. Do not do that.
So Manny has just mentioned, besides recognizing the power of AI, is this at present likely to save time for the practitioners? Is there a discussion with regulatory medical bodies happening that may consider accepting this as a tool medical practitioners can use? Of course, this is a very wide question and beyond the scope, but briefly, can you address this?
Sure. So here's again, just as the saying said, tomorrow is a mystery. So I will share with you that my view, and again, of what it is pretty much ready to change medicine now, and it is changing. In our practice, it is changing, is being able to do some of the mundane tasks that we didn't need to do. So most of you use email. So your email, some of the email programs will tell you based on what was the message, what your response should be. Say, for example, somebody sent you, okay, do you want to get together for dinner tomorrow at 5 p.m.? And that's in an email. You hit reply. There's already an options there, 3 options. Yes, no, maybe I'll get back to you, that kind of thing. So that is the area where the clerical or the administrative burden of medicine is going to go down. One of my family physician colleagues shared with me that, oh, Mukesh, I had 160 inbox emails to deal with. Now, if it could just say which one of them are normal lab test and patient has an appointment tomorrow, you don't need to open these emails today. So there are tools that can do that. And that is where I'll put a link that I have created a LinkedIn group for what I call it Cognitive Augmentation Tools in Medicine, CADM. And if those of you who are interested in presenting, sharing, learning together, you can ask to join the group and do that. Again, that is just a personal passion group that we have created. So sure.
Would integrating AI with medical repository like uptodate.com generate point of care answers to the busy physician?
Okay, so UpToDate has already had the idea. They are in beta version. They are, I think, if you were living in the United States, they would allow you, or you can apply to be in that, where the big repository of UpToDate will be the localized chat GPT. This is what is called edge computing. This is what the Microsoft's newest computers have come up with, where you can literally run the large language model on your large data set locally, because there's a lot of privacy issues with it. Like my patient practice, if I wanted to know how many people have blank disease and are they on goal, etc., it should be a query. But yes, the answer is UpToDate has already thought of it. It's in its beta version. Stay tuned. They'll be out any moment and they'll ask you to pay more for the same subscription.
will ChatGPT be able to interpret ECG better if licensed PDF on ECG interpretation is also uploaded? Basically, I think he's asking about loading a PDF, and I think you said yes. No.
No. So if you load a PDF or a picture, it was pretty much the same. If you included the auto interpretation from the machine, it actually became worse because it was trying to read that, because it would say unconfirmed report, and then it'll say, oh, this is an unconfirmed report, and it will just try to describe it. It was literally like somebody who had just using what is available to them. Every single did cell it saw on the screen, it will try to analyze it and report on it.
One is ChatGPT will not, Dr. Nuruddin Bora, ChatGPT will not give you 100% accuracy result. Those who are perfect to read, prefer to read, I think, ECG, she can correct error like last ECG. ChatGPT showed arrhythmias in spite of pacemaker spikes. ChatGPT will not give you 100% accuracy result. Those who are perfect to read ECG, she can correct error like ECG, like last ECG, which showed arrhythmias in spite of pacemaker spikes.
Right. So this is an open question of whether if I gave a thumbs down that this reading was not accurate, or argued with the ChatGPT model, does it learn, and does it learn permanently? I think it is too early to tell. These are called self-learning. Where I think it could be useful for the people who are good at ECG reading is when you have a tricky ECG that you are struggling with, load it up and see what it brings out for you and say, I'm debating whether this is ventricular tachycardia or left bundle branch block with sinus tachycardia. Can you help me do that? You know, presence of acute myocardial infarction in the setting of left bundle branch block. Does it show that? And because you also have the result, you have the patient in front of you. So that is what crowdsourcing this group can do, is say, oh, let's try that and see what is the collective experience of this.
Sounds like a research project. So the last comment again is by Dr. Kishore Madhwani. Hence, ChatGPT definitely helps us to not miss out on probable conditions which could have otherwise been missed by us. It is our aid. I'll repeat again, it is our aid, our buddy, and definitely not a replacement of our services.
Right. So I call it the cat. Kishore, rather than an aid, call it a cat, a cognitive augmentation tool. And I added IM to it, which is for in medicine. So that is why the group is called CATM. But this is literally a cognitive augmentation tool. What we have to realize is we should not become lazy, that because this thing shows A, we stop listening to it because it was right 10 times. Because even now, if you think of all the things that are out there, self-driving cars, self-flying planes, the planes land by wire, you don't want that the pilot doesn't know how to drive, doesn't know how to fly the plane, because we know what happens with that. So really, the thing to be excited about it is that today our lives are going to change more than what they changed in the last couple of years because of this technology. The thing that we can do is really be engaged in the conversations with an open mindset. And I was getting nervous because the topic and how this talk was shared was that I'll get to know how to read ECGs using ChatGPT. And my conclusion was, no, you will learn how not to read ECGs using ChatGPT. That is a no-go for now, but you can learn how to read learn ECGs.
Okay, so thank you very much. And I think we can, Dr. Vidya, you can come in and propose a vote of thanks.
Thank you, Dr. Kamlesh. I was listening for the last 1 hour to understand how we can go to the next level of using ChatGPT and interpret the ECG. And Dr. Mukesh came up so well to say that, look, it's not a replacement for you. It's just a tool which will help you in the process. So we still have to use our brain. We still have to be very cautious. We still have to look at our patient, understand their clinical problems, interpret as we always do, but not to forget there are new tools available. Use those tools which will augment your clinical judgment and help in the treatment. So I think that's what we discussed in the last 1 hour. And thank you, Dr. Mukesh, an amazing set of examples you gave with the ECG, with live demonstration, which made us realize that this can be done and this is what we should do. And we should keep our minds open. Of course, we are ready to join your LinkedIn group. And thank you so much for sparing your time, especially Sunday morning for you. And for all of us, I'm glad we postponed our session today so that we were all able to watch the cricket yesterday. And thank you to all the participants or the delegates who were there with us today. And we'll have few more sessions soon. And I'm sure Dr. Kamlesh and Dr. Roshni will be there with us and guide us for the next step. Thank you all for joining us today.
Thank you. Thank you very much.
Thank you.
Thank you so much.
Bye-bye.